everybody, this is Patricia Saxon, one of the hygienists here at Boulder Dental Arts, and we're preparing to do a number of informational videos, questions that you guys ask us all the time. We're going to put it here so that everybody has the answers, not just the person who sits in our chair. So first, we're going to do gum brushing 101. Everybody that sits in my chair needs to know how to brush properly. And to do that, you need a tiny little toothbrush. Wait, I'm going to back up because Mythbusters, everybody thinks there's something special that needs to be done. I'm here to tell you that's really not the truth. Is there any special toothbrush? No. Is there any special mouth rinse? No. Is there any special toothpaste that's better than another? No. So, get back to basics. That's what I tell most of my patients. Get back to basics. All you need is a tiny little toothbrush. Of course, it is always soft, and how you use it is terrific. Okay, so here we go. Small toothbrush, you want to go what I call gum brushing 101. Every 20 minutes, whether we eat or not, our body is producing bacterial plaque. That's why we brush. We want to disturb that. It's not even about removing it. It's about disturbing it before it gets colonized. So, take the tip of your toothbrush and you're going to use it a lot like a toothpick. You start in the back of the mouth and you come forward all the way to the front. Looks something like this. And I had one of my patients say the other day as I was showing this, do you have to make those funny faces? Well, kind of, because you got to get your lips out of the way. So here we go. And I'm going to show you here in the front because if I go in the back of the mouth, you're not going to see. So yeah, see my funny faces? But you poke those bristles right up underneath the gum. I've come all the way to the front. Now we're going to come from here. So same thing, all the way. And you come up to the front, making sure that you poke 3 or 4 little bristles up underneath the gum. And anywhere it'll poke in, you poke. Poke's a great word. You're not going to hurt your gums. In fact, that's where we need to focus, is up underneath the gum. Part of your gum is not attached to your tooth, and that space absolutely needs to be cleaned. Same thing on the bottom. Start in the back, and again, you come to the front, poking those bristles below the gum line. All the way to the front, back to the front, and then of course you do the inside. This should take you 2 to 3 minutes, and gum brushing is done with a dry brush. You see, I don't have anything here. Did I just get my teeth clean? Well, yes, if I'd have spent the full 2 minutes, but here's what I want you to know and what I tell all my periodontal patients. If you get a handle on what I call the 3 T's, you're going to get well and you're going to stay well, because what we're finding is many of our patients have gingivitis and periodontal disease. Unfortunately, it's very common. So here's the 3 T's. 2 times a day. That is critical. Absolutely critical. If you're only brushing once a day, you are going to have a problem at some point. Maybe limping along right now because you're young. But the older you get, you will have a problem. So that's the first thing, twice a day. The next one, 2 to 3 minutes each time you brush. And you know what? I want you to time it. 2 to 3 minutes is a long time to be up there. The first minute you're brushing your top teeth inside and out, your top gums inside and out. Second minute, bottom gums inside and out. Dry brush, no toothpaste. But the third minute, you can put a little tiny bit of toothpaste on there, and you know what? You can brush your teeth anyhow you want to, as long as you're not going back and forth. But typically, it's in a round circle motion. So, 3 T's, 2 times a day, 2 to 3 minutes each time you brush, and the third T, the technique that I just showed you, which I call gum brushing 101.
Yay, that's awesome.